So what is a nerve? A nerve is basically it's like a slimy tube. It's white, it's kind of shiny. They're found throughout the body, up and down, crossways, diagonal, and they basically connect the brain and the spinal cord to everything else, okay? This picture on the bottom is the perineal nerve. That's on the outside part of your knee, and that's a nerve I actually release a fair amount surgically for entrapment or put peripheral nerve stimulators in. That is the pain people feel if that nerve there is entrapped or compressed or irritated or ectopically firing. People will feel pain down the side of the leg and top of the foot. Remarkably similar to what a lot of people complain about with sciatica. But that shows you a live picture of the nerve, and then this is a microscopic cartoon of the nerve. It's basically a bunch of threaded bundles, almost like tendons and ligaments. This is sort of how the body likes to organize things, spiral some bundles up. And they're all separated by different layers of connective tissue, and they have, vessels feeding them oxygen and whatnot. But that is what a nerve is. It effectively just carries electricity. It's like the power cord, working the computer right now. It's going to carry electricity one way and the other. And that electricity will signal certain neurotransmitters or proteins that signal different functions in the body and brain. All right, another definition of nerve is a person's steadiness or courage and how you brace oneself to face a demanding situation. And I think the two go hand in hand, because if you have nerve, then you can handle pain. You know what I mean? I don't want to make that sound too silly, but the reason the word nerve means steeling yourself and going forward, and the same derivation of the word nerve is used for nerves. There's a reason, because there's a strong connection between the brain, the body, and how you front face the world and how you handle stimulus coming in. This is really important and really cool if you think about it, that really a nerve, the only reason you even feel pain is because of an electrical circuit. Okay, everything is driven by electricity, by what are called ions. These are molecules that either have a positive charge, a cation, or a negative charge, an anion. And the fundamental minerals that you think about, calcium, sodium, potassium, chlorine, all of these are massively important in our day-to-day life, and they're the only reason I'm sitting here talking to you, is because of these tiny little charged molecules that are running up and down in my body right now, firing, not firing, pumping in, pumping out, and sending signals and making my brain work and my mouth and voice come out. You can understand it, all because of these ions. Specifically sodium and potassium, and then calcium at the end of the nerves, and we're going to talk about that. The function of the electrical circuit, the actual spike in activity, is called an action potential. And then there are things called gap junctions on nerves, insulated nerves that are surrounded by this fatty layer called myelin. Just like electrical cables have insulation, right, to protect them and to make them work better. Copper cables are insulated a lot of times. Myelin insulates our longer nerves, and then between the bits of myelin, there will be a gap, and this makes the nerve function more efficiently, a gap junction. We're going to talk about that. And all of this works because in that sheath, and then on the cell membranes, which we've talked about how important cell membrane function is before, in the cell membranes, there are a series of pores and channels and pumps that either let the ions in and out, stop them, let them leak in, let them come in a massive flow, induce an action potential or whatnot. But basically, the human body is a very controlled, coordinated system of ion movement. And that is all pain is at the end of the day. So I put this here because I just find this over and over again when I'm reading and studying and doing research. I'm just fascinated how everything that we humans do that we think is so awesome and inventive, if you think about it and go look, it really just mirrors something that's already been done in nature. They're starting to see this with the ways cities map out and transits. It all looks like neural connections in the brain. And here on the top picture is a power system, a power grid. You've got the generating station, you've got your transmission lines, you've got a step-up pump, you've got a step-down transformer, and then it goes to each of the individual homes. Well, look at it. It looks just like the body system. You've got the source of an electrical signal, you've got the transmission lines, you've got the step-up transformers, which is when it hits the next cell body and starts again and again. And then it goes not to homes, but to the peripheral nerve endings that say, oh, hey, you want to point there, or oh, hey, your cheek itches. All of this is the same thing. It's electrical signals start somewhere, and there's passed in a controlled fashion to go somewhere specific. So the basic circuit in your body is this. You have a neuron, and it sends the signals through the axon through the action potentials to what's called a synapse. A synapse is just a connection between nerve A and nerve B. And so the synapse will actually drop out neurotransmitters. Those are like little proteins. Those signal molecules cross that cleft and then stimulate an action potential in the next nerve through these processes called dendrites, which are like the transmission cables, goes to the center core of the nerve. Another action potential is signaled, passes down the axon, through those areas, those gap junctions with the insulation of the myelin, and then it goes to another synapse, to another dendrite, to another cell body. So that's your basic circuit. So you can control things in your body by controlling the synapse, the proteins that are released or not released at the synapse, the reuptake of proteins there, the recycling of them, and then also how the action potential is propagated from the dendrites to nucleus. The nucleus obviously is filled with a bunch of genes that can turn on or off and then change how certain signals happen. And then, of course, how your axon is functioning will also change the transmission of signals. But this is your basic circuit. This is going on all the time in your body, throughout your body, with or without your conscious control. Okay. All right, and this all happens because of the cell membrane. Y'all know I'm a huge fan of healthy cell membranes, big fan of omega-3, things like that. But in the nerve cell, it's especially important. You have to have a solid cell membrane that works perfectly because everything hinges on what's called a membrane potential, which is a charge gradient. So on one side you have positive, one side you have negative. Nature does not like uneven things. That's why a vacuum will always suck in air or water if it can. It likes things to be balanced. So if there's too many positive ions on one side, it's going to try to osmotically push them to the other side. If there's too many particles on one side, it'll push it to the other side. So you want this constant balance. The way that the nerve works is it keeps positive outside, and then the action potential lets the positive ions drop into the cell, changes the membrane charge in the cell from a net negative to a net positive. And that is the voltage signal that tells the nerve, pass this signal on, go to the brain, tell the brain X, Y, and Z. So the charges normally flow from positive to negative, okay, and also from a high concentration to a low concentration. This is controlled by what's called a semi-permeable membrane. So this membrane is not just like a piece of cloth where if you had salt water over here and fresh water with a piece of cotton, it would osmotically equilibrate over time. The membrane between controls it and only lets through the ions or cations or anions that it wants. And that's through either the channels or pumps. So at rest, when you don't have an action potential, when the nerve is not firing, like let's say the nerve to my big toe right now, you're going to have it permeable to some potassium and some chlorine, but then at rest, it's impermeable to sodium. So it won't let sodium through. Sodium has been built up to a higher amount outside, so it's net positive outside. And then as soon as you get that signal, it's going to drop in the sodium into the cell. The potential inside the cell is going to go from negative to positive, and then you get a signal. So just remember, it's all hinges on this membrane, and the membrane keeping negative inside, positive outside until there's an impulse from an action potential and the nerve needs to work. So what regulates that permeability? Well, the charge does over time. Also certain proteins, genetic things, different genes being turned on and off. But effectively, it's all controlled by the charge gradient, which is controlled by the voltage-gated channels, the sodium-potassium pump, and then there's some smaller channels that open or close based on mechanical things, or they might sense that the gradient is a little bit too negative on one side and too positive on the other side, and it'll let like potassium leak through a tiny pore that's really only big enough for one potassium molecule, if you could imagine. The voltage-gated channels, remember that term? That's everything to do with pain. And the voltage-gated channels is how we try to control pain and modulate it for patients. The voltage-gated channel would be the sodium channel that's generally closed until it gets a certain signal, which is a volt, right? A certain positive signal that tells it to open. And then the sodium floods in, and you get the same thing just keeps propagating down the nerve. So all of this permeability is controlled by channels, pores, and pumps that are sitting in the membrane that are signaled either by a voltage, so positive or negative, or they're signaled by some mechanical thing, or what's called a neurotransmitter, which is a protein that will link on the receptor and cause it to open or close. So that was pretty complicated, but you could see here, so a closed channel and open channel. And that open channel will have a very selective fit. It will only potassium, or it will only let through chloride, or it will only let through sodium. And generally, there's some potassium cells that are slightly leaky that let this certain resting membrane potential happen. Generally, it's negative 70 millivolts inside the cell. That's how it's supposed to be. And then there's a lot of positivity outside. If it starts to get too negative inside the cell, the system will let some negative anions leak out, or they'll conversely, if it's not negative enough, it'll let positive ions leak in. I may have said that backwards. But anyway, you get the point. Now, after the action potential happens, well, how do you get all the sodium back to the outside? Well, there's actually this ingenious pump system. So the sodium inside the cell binds to this pump on the cell membrane. And when you hear pump, you naturally think, well, that's active. Something is making this happen. And yes, it requires energy. So the pump actually uses ATP, the energy from an ATP molecule, to open and close. So it's open on the inside, sodium binds it, 3 sodiums, and then a phosphate group off of an ATP gives it energy, and it flips its conformation or shape. And then the sodium goes outside, and then 2 potassiums bind, and it drops it back in. So it just keeps doing this over and over again at a 3-to-2 ratio until you get that resting membrane potential that you need to make the nerve function properly. So it's a pretty ingenious system, and you may be wondering, why does it do that? And I'm about to tell you, but it's pretty cool. So again, everything hinges on the relative negative and positive between the inside and outside of the cell. Now, that is everything. That is all pain is. And so this is basically the pump gets you set up for the next action potential. Okay, so the signal, remember the basic circuit. We get another neuron, goes to the synapse. The synapse sends a protein, which triggers an action potential at the dendrite in the new nerve, and then so on and so forth. So the neurotransmitter at the synapse is key. That's a protein that attaches to a receptor that says, hey, let in an influx of sodium. Let's get this ball rolling. The pores open, the charge rushes in, goes from negative to positive, and then at a certain level of positivity, everything shuts down, doesn't let any more sodium in. The membrane potential equilibrates, the sodium switched for potassium, and it gets it all set up again. And I mean, this is happening like faster than you can blink an eye, obviously. This is like nanoseconds, which is amazing when you think about it. Okay, so this is the action potential. And I don't know if anybody out there remembers their high school chemistry or biochem, but this graph is the only reason that anything works. So you have that negative 70 millivolt resting membrane potential. If you get a certain amount of charge that comes in from another signal from another nerve, a certain volt, that volt will let in a certain charge. When it hits a certain level, that is the threshold. There's a threshold that's been met, and then you have an action potential. So once that threshold is met, the sodium channel's open, sodium pours in, you get this massive switch from negative to positive. Sorry. I'm getting so excited about this. And you get this peak action potential. So you go from negative 70 millivolts all the way to positive 30. So it's a 100 millivolt change. That happens almost instantaneously just because the channel open and let sodium come in. That's how quickly the body wants things evened out. It's peak action potential. Then you hit that number, and then these channels are voltage gated. Oh, that's too positive. We need to shut down. They shut down, no more sodium in, and then potassium crosses to get it even in polarization. Well, usually there's a little bit too much. That's hyperpolarization. The pumps happen. You get sodium on the right side. You get back, and you're ready at that negative 70 resting potential again for the next threshold to be met. So it just moves in waves, almost like all electricity does, right? Light electricity moves in waves, sound moves in waves, and this electrical thing down the nerve moves in waves. So again, nature mirrors everything else, or I should say everything else mirrors nature.